Hello everybody, my name is Constance Ternisien. I'm studying to be a speech therapist fourth year in Rouen, and I'd like to introduce our research project called Characterization of Oral Language in the Mid-1L Syndrome. I am working under the supervision of Dr Juliette Coursimault and Mrs. Laura Lechevalier. We will go over the introduction. We will try to define language. Then we will review the literature and language disorders, speech disorders, and then we will look at what we can find in the mid-1L syndrome with regard to that issue. I will go into the details regarding my clinical research project and the details, and the tools and the details, and we will look at the results before we close. What is speech? It's the human capacity to communicate. It's based on a lexicon, i.e. all the words that a person can understand and use. Phonology, i.e. the rules to organize phonemes within a language in order to convey an idea or a concept. It's like the sound grammar. Then we have syntax that looks into how words can be combined to form sentences. Semantics, which is the meaning of the words and what they convey. And finally, pragmatic, which is the social and context-related way we use speech. Now we're going to look at the place that language disorders occupy, speech disorders occupy within neurodevelopmental disorders. Antoine de Rondeau already mentioned this, but you need to know that communication disorders are part of the neurodevelopmental disorders. And now I would like to focus on the communication disorders. And among the communication disorders, we find non-specific communication disorders, social communication disorders, phonation disorders, the disorders linked with verbal fluid behavior, and finally we have speech disorders. Speech disorders are defined on the international scene with 4 criteria. The challenge can last in time, both in acquisition and understanding of speech. There is also a mismatch with the child's age. It will start in the early phase of development, and the difficulties are not explained by another disorder such as blindness or another sensory deficit or a motor or cerebral palsy or deficit. Regarding speech and mid-1L syndrome, in the literature we find a speech acquisition retardation, the fact that the speech is not understandable. When the person talks, it's difficult for the other people to understand what he or she is saying. There are communication difficulties, understanding disorders, compensating strategies to keep talking, and difficulties to maintain.
On retrouve également des difficultés de régulation du volume vocal. Souvent, ce sont des sujets qui ont tendance à parler très fort. Des difficultés dans l'utilisation
a conversation. There are also trouble regulating the speech volume, people who tend to speak out very loud. Trouble to use speech in the contextual way in the social interactions. Difficulty when there are several instructions. Heterogeneity in the communication capacity. A rather developed lexical store of words, and the capacity to write and read, which are limited, but it may vary. So how should we phenotype speech disorders in a more efficient way within the framework of the mid-1L syndrome? The speech disorder is not well characterized. There are no studies dedicated specifically to this issue. All we have are retrospective data, studies looking at past data with no real-time observations and no benchmark, no control on the situations to be observed. There's no common protocol, and therefore we can't give very detailed observations on the speech-related aspects. We have trouble finding a result and connecting that with neuropsychology. There is a connection between speech and other cognitive aspects. And as soon as we can phenotype speech disorders, we can improve the early screening of speech disorders, and we can adjust the way the patients are managed and followed. For all these reasons, we decided to perform a research project in the teaching hospital in Rouen, and we focus on oral speech protocols. For this research project, we developed a protocol using several different tools. As we said in my introduction, we are looking at phonology, lexicon, syntax, semantic, and pragmatism, and pragmatic sciences. We have orolingopraxia, the movements of the cheek, the lips, the tongue during speech or when trying to emit a certain number of sounds. For instance, we ask the subjects to place the tip of the tongue behind the incisors towards the palate or downwards, or to inflate one cheek or the other. Then we ask the subject to repeat complex words to see whether there are any problems with the sound. And finally, there is a so-called phonologic discrimination test. We want to check that the subject can make the difference between speech-related sounds, between an S sound and a sh sound, or a v sound and a f sound. We also ask the person to say we say chifumonde or sifumonde, and we ask the subject whether they are the same, or fukonlo or fukolo, are they the same, etc. Self-5 is a scale to assess understanding and production of speech. For younger patients, we have the syntactic understanding test, the capacity to understand sentences, basically. For instance, I ask the subject, show me the grey dog in the box. The grey dog is in the box. Second test, semantic associations, testing the capacity to establish a connection between items. For instance, the instruction will be, tell me the two words that go together. Pram and baby, helicopter and airplane. And the child should make the connection between the two vehicles. And finally, the last one is morphosyntactic production, to analyze speech production in order to complete a sentence. For instance, what does the boy do? He's combing his hair. What is the girl doing? She, and the child should finish the sentence saying she's having a bath or she's washing. For older children, we chose a semantic association test and also a test to understand a text that I'm reading, and followed by a few questions. For production, we chose a test to elaborate sentences based on a picture. Then we asked the family to fill in a questionnaire on a pragmatic profile. This questionnaire aims at identifying pragmatic difficulties that the child may be suffering in daily life. For instance, the item was maintains visual contact and an appropriate posture during a conversation. And every time the family can say never, almost never, sometimes, always, or almost always. For the lexicon, we use the EVT3 test, measuring vocabulary available for production. Here we have a peacock, and I asked the subject, what is the name of that bird? There is also a test to find synonyms. For instance, we asked the subject, tell me one word that has the same meaning as fixing something broken. Like in this picture, the man is fixing a broken cup. Then we have PPVT5, measuring the vocabulary that can be understood. Here, 4 images. The subject should point at the right answer or provide the right figure that matches the target. For instance, if I say, show me the picture where an apple can be seen, or show me the image where swimming is shown. Then we asked the families to fill in a second questionnaire. This will be the last one. There were less questionnaires than for the neuropsychiatrists. And this questionnaire is a scale for intelligibility in a context. It assesses the way the subject can be understood when speaking by people around him or her, parents, teachers, siblings, or other people. And this questionnaire tells us how understandable that person is in daily life situations. For the results, in total 22 patients were included between the ages of 6 and 35, and we found that all the patients were easily tired and most of them had attention disorders, the majority. Right now, unfortunately, we cannot give you more details because the data is confidential. The results are currently being analyzed, but there will be a publication. But in conclusion, if we go over everything we observed regarding speech characterization in the MIT1L syndrome, we have many scientific papers with abundant data. However, the data is only retrospective. There is no specific research protocol, and the data is very difficult to compare. The aim of the study would be to improve phenotyping of speech disorders in the MIT1L syndrome, to have a bigger cohort, and here we have 22 patients, and to improve follow-up and speech therapist management for these patients. I would like to thank you for your attention. I would like to thank the families for having agreed to participate in the protocol and for having come to us. And thank you to the association for everything they've helped us with, and to my two supervisors, Juliette and Laura, for their kindness and the time they have dedicated to this project. And now Cécile will tell you about prosody. Good afternoon. My name is Cécile Mauger. I'm also a student in the speech therapy school, 4th year. I will talk about the prosodic characterization in MIT1L syndrome, also working under the supervision of Dr Juliette Coursimault and Mrs. Laura Lechevalier. We will start with the introduction, then we will do a review of the literature showing cases of prosody in other genetic syndromes, and we will talk about prosody in this MIT1L syndrome. I will explain our clinical research project within the Rouen Teaching Hospital, presentation of the tools, information regarding the results, and conclusion. Maybe you know what prosody is, but I will give you a definition, a very short and clear definition. Definition is the melody in speech. Prosody are all the elements that are added to the words, such as accent, rhythm, tones, melody. It can be measured with three main characteristics: the intensity of the voice, the power. People can talk very loud, or on the contrary, not very loud. And a conversation will be approximately around 50-60 decibels. Then there's the duration of the speech, the pauses, the time for a vocal segment, and finally the height at which the voice is pitched. Boys have a lower pitch and 120 hertz, women 200 hertz, and children 250 hertz, so very high-pitched voice. And this variation in the fundamental frequency can be due to the vocal cord anatomy. Women have shorter and thinner vocal cords, whereas men have longer and wider, thicker vocal cords. Prosody is the music in speech. It can be emotional or linguistic. When it's emotional, it indicates emotions, intention. It has an impact on understanding. It's universal, and it's usually managed by the right hemisphere of the brain. If I say thank you or thank you, the intention is different, and the emotion conveyed is different. Linguistic prosody structures the speech and therefore codes the information. It has a connection with the meaning, the lexicon, the words used, the syntax, the pragmatism, and everything we produce is adapted to a context. It depends on the language. In Chinese, the linguistic prosody will be different and based on the lexicon and the tone on a word. The word is written exactly the same way, but depending on the tone, it will have a different meaning. The same applies to English. The accent will make a difference, and the word will mean something else depending on how you accentuate the word. And it will be managed by the left hemisphere of the brain, especially in right-handed people, like, are you coming or are you coming? In one case, it's a statement. In the second case, it's a question. Prosody also plays an essential role in the speech development in children. Very early on, prosody helps babies understand better what we say. If I say to a child, are we going to drink a bottle? It's not quite the same as it's time to eat, time to have a bottle, or time to have a bottle. And the words eat and bottle will be highlighted, and understanding will be encouraged by the prosody. So the way we talk to babies is very important and helps develop future interactions. What is the interest of prosody in daily life? It facilitates understanding of the speech. It helps, it supports language development. It reinforces the impact of a speech, and it helps express and perceive emotions. And it can be a lever to treat children being treated for autism spectrum disorders or aphasia. Now, we should look at prosody for neurodevelopmental disorders because it helps improve understanding of linguistic profiles specific to each syndrome. It helps understand the impact of social communication. Sometimes it is exaggerated, sometimes it's too monotonous, and it has a different impact on the other people. And we can also use prosody as a biomarker, a diagnostic tool, or a tool for therapeutic management purposes. Prosody in neurodevelopmental disorders has not been studied extensively. There are a few articles looking at prosody in genetic syndromes such as Down syndrome or Williams-Burren syndrome or autism spectrum disorders with a number of etiologies. I'm going to tell you about a meta-analysis. Meta-analysis being a group of scientific papers on the same subject. This meta-analysis is based on 9 papers on the syndrome that I mentioned earlier, autism, Williams, and Down. No data on any other genetic syndromes. That's why here we have autism, Williams, Burren, and Down syndromes. The tool being used in all of these articles is PPSC, which I will explain later, and that I used in my protocol. Results. Prosody is altered in all 3 syndromes, but there are very specific profiles. For Down syndrome, the subjects are challenged, and there are overall low capacities, but the understanding is higher than expression. In Williams-Burren, the challenge is linguistic prosody, but there is a better capacity for emotional prosody. And for autism, the difficulty lies in the fact that it's more difficult for them to express emotional prosody, and they have better competences for linguistic prosody, and understanding is greater than expression. We find that for each syndrome, there is a very specific prosody involved, and that's exactly what we're trying to look for in the MEAT1L syndrome. No scientific work so far has been conducted regarding the MEAT1L syndrome. Some clinicians worked with MEAT1L patients and felt like there was a very specific prosody, and so they started looking into it. Prosody had already been studied in Williams-Burren syndrome, which shows hypersociability and exaggerated prosody. So maybe MEAT1L prosody is exaggerated, and that's what we're trying to understand and figure out. For clinical stakes, a diagnostic tool or follow-up tool and then help to manage development. For the ongoing project, I would like to understand why the patients had to be French speakers, because prosody is very specific to a language. And if we had included patients from other countries speaking different languages, we would not have been able to compare the results between the languages. The interview took place for 1 hour, both production and reception, in the teaching hospital in Rouen. The aim being to characterize prosody in MIT1L syndrome and characterize prosody in this syndrome versus other genetic syndromes which have an impact on neurodevelopmental neuro disorders not connected to MIT1L. The inclusion criteria for the control group was the presence of a genetic syndrome confirmed with a molecular test, a neurodevelopmental syndrome that is not MIT1L. All the patients had to be older than 6, and they were matched for chronologic age, so they were more or less the same age in both groups. And all the patients, the control group, comparing the results and the subjects, had to be managed within the teaching hospital in Rouen. For the tools used for the protocol, we used 2 tools. Diadolab, a software that analyzes expression prosody. Through repeated sentences, the patient heard, "Hello, Mr. Tralipo," and were supposed to repeat it in the best possible way. The second sentence was, "Do you know Glochin the squirrel?" And the patient had to repeat the sentence. Regarding the diet Coursimault, they were repeating syllables, pataka, 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 for 7 seconds in order to check whether the speech was really fluent. And finally, prosody is analyzed through vocal records, recordings that were performed to analyze the height, the flow, the tone, and the pauses. The second part was aimed at analyzing understanding with PEPS-C, distinguish the statement from the question. A word bread, they had to say whether it was a statement or a question. Also, removing ambiguity from ambiguous sentences. If I say 181 is not the same as 181. And also the word had to be selected. If I say apples and strawberries, the accentuated word is apples. And also we had to decode the affective state of the speaker, whether he or she liked or did not like the word. If I say strawberries, you can see at my face that I like strawberries. But otherwise, you have to detect whether the person likes strawberries or not. And finally, recognize identical or non-identical noises. They were not understood, but they had to say whether the words were, the noise was the same. Regarding the MIT1L patients, 22 patients between the ages of 6 and 35. Different challenges were observed. Fatigability, the response time was longer, the attention was fluctuating, and finally, understanding the instruction was sometimes difficult. Positive elements of recruitment, thanks to the Extravaillant Association, they helped us with the recruitment in Rouen, and passing on and collecting the results. In the control group with other genetic syndromes, the idea was to include 22 patients. The process is still in progress, and we had challenges finding participants because when the people come to the hospital for a consultation, we have to submit them to the test. But this is not going to help them with their own disease. It's only for research purposes. The positive element is that it's currently being performed, and right now we have 4 patients included. The results are currently being analyzed. The publication will be coming up soon, and the results are unfortunately for now confidential. Conclusion. Prosody in MIT1L syndrome, it's something new. There is no scientific data published to this day. The aim of the study is to better understand the speech profile of the syndrome, to maybe come up with a biomarker or a specific diagnostic tool on top of everything we have already available, and use the prosody as a therapeutic tool for speech therapy. The study is in progress. Inclusions are continuing for the control group. 22 patients are included for the MIT1L group, and results will be published this year. Thank you very much for having participated in this study and for having listened.